Thank you for inviting me to AIOS Symposium. Today, I would like to talk about anterior segment optical coherence tomography imaging of filtering blebs after trabeculectomy with M90 membrane transplantation in patients with primary open-angle glaucoma. Trabeculectomy is still gold standard for glaucoma filtering surgery. However, it has complications associated with mitomycin C and 5-FU. Previous studies of trabeculectomy with M90 membrane transplantation reported that it is effective in IOP control with less complication. Our group reported that trabeculectomy with AMT in Korean patients with POAG has comparable success rate at 1 year after surgery. However, a vascular cystic bleb was not observed in the AMT group, while 8 eyes in the control group has a vascular cystic bleb. The purpose of this study was to analyze the anterior segment optical coherence tomography-based intraocular parameters associated with long-term intraocular pressure control in patients who underwent trabeculectomy with or without amniotic membrane transplantation. And cryopreserved amniotic membrane with stromal was used in the surgery. This was retrospective comparative study with 128 eyes of 107 patients. 43 eyes of 38 patients were included in trabeculectomy with mitomycin C group, and 85 eyes of 69 patients were included in trabeculectomy with mitomycin C and AMT group. All patients had follow-up more than 12 months, and success criteria at ASOCT examination was IOP less and equal to 18 mm of mercury and IOP reduction more than 20% without glaucoma medication. Spectral domain spectralis OCT was used in this study. When it comes to intrableb structural parameter, radial and tangential scans were measured at the maximum height and extent of the bleb, and then mean values were calculated. Bleb height, bleb wall thickness, internal fluid space height, microcyst formation, stripping phenomenon, and lake under scleral flap, and fluid filled space score and stripping layer thickness were measured. There was no significant difference in demographics and clinical characteristics between two groups except OCT test interval. When we look at intrableb parameters in the control group, we can see that bleb height, bleb wall thickness, stripping layer thickness, stripping, and bleb wall ratio were greater in successful group than in unsuccessful group, and microcyst formation and stripping phenomena were more frequent in successful group, whereas bleb wall reflectivity is greater in unsuccessful group and encapsulated bleb was more frequent in unsuccessful group. When we look at intrableb parameters in the AMT group, we can see that bleb height, bleb wall thickness, stripping layer thickness, stripping and bleb wall ratio, fluid space area, fluid field space score were greater in successful group, and microcyst formation, stripping phenomenon, and lake under scleral flap were more frequent in successful group, whereas bleb wall reflectivity was greater in unsuccessful group and encapsulated bleb was more frequent in unsuccessful group. When we compare intrableb parameters between two successful groups, we can see that bleb height, bleb wall thickness, stripping layer thickness, stripping bleb wall ratio were greater in control group, and stripping phenomena was more frequent in control group, whereas internal fluid space height, fluid space area, and fluid field space score were greater in AMT group. We performed multiple logistic regression analysis to evaluate which variables are associated with success of trabeculectomy in control group. The result showed that higher blood wall reflectivity had negative impact on good IOP control. The result of multiple logistic regression analysis in AMT group showed that higher blood wall reflectivity still had negative impact on good IOP control, whereas greater fluid field space score and microcyst formation were associated with good IOP control. This slide shows you right and left eye of same patient who received trabeculectomy in both eyes. Right eye received trabeculectomy combined with AMT, and left eye received trabeculectomy alone in other clinic. ASOCT shows that suprascleral space extended posteriorly behind the field of view after trabeculectomy with AMT, whereas multiple fluid collection covered by a thin layer of conjunctiva was found in the left eye after trabeculectomy alone. This is another case of different intraocular structures of eyes in the same patient who received trabeculectomy with or without AMT. ASOCT shows hyporefractive blood wall with microcyst, and suprascleral space extended beyond field of view. Although slit lamp bleb photographic image of the left eye after trabeculectomy alone looks similar to that of the right eye, the anterior segment optical coherence tomography image of the left eye was quite different from that of the right eye. ASOCT image shows that hyporefractive blood wall with prominent stripping phenomenon. ASOCT image of the patient with good IOP control after trabeculectomy with AMT showed that fluid field space extended posteriorly beyond field of view, whereas ASOCT image of the patient with good IOP control after trabeculectomy alone showed that prominent stripping phenomenon in hyporefractive blood wall. In conclusion, we found that factors related to successful IOP control in both groups were high bleb height, thick and hyporeflective blood wall, and microcyst and stripping of the bleb. It suggested that transconjunctival pathway of outflow play a role in both groups. We also found that factors associated with successful IOP control in AMT group was the internal fluid space extending toward the conjunctival fornix, and it suggested that subconjunctival pathway of outflow play a role in AMT group. Thank you for listening.